Hello, everybody. Good morning. And for people in Canada and USA, and good afternoon for everybody, almost everybody else in Europe and the Middle East. Thank you for being part of this show again. This is episode 6. We have some interesting guests with us today. We will give everybody a few minutes or a couple minutes to tag some people and get some audience going, and we'll start soon. Thank you. Okay, everybody, how are you again? Welcome back. Episode 6 of helping people, helping small businesses, and talking to interesting people around the world. So today on our agenda, we have obviously our Mythbusters. It looks like people are enjoying this. Our guests today, we have 2 Dr. Dunyas today. Obviously, there are a couple. I was hoping to have my first couple on the show, but Dr. Dunya was called away for some consultations. Maybe, if we get lucky, she'll come back and peek through, but maybe we can have her on next time. She's a pediatric cardiologist, so that could have been interesting. Our other guest is her husband, Dr. Gabriel Dunya. He's an ENT, ear, nose, throat. So if you have any questions about ear, nose, throat, we can ask Dr. Dunya. Obviously, remember, if you have an emergency, you should be contacting your own doctor or going to the hospital. Then we have Alexander Butros. He's a nice guy from Sweden. So it's a good thing to find nice guys and talk to them and see why they're being nice during this pandemic. So first, Mythbusters. So remember, this is the link. If you're on the phone, just text the answer in, and then I'll plug it in for you, okay? So don't worry about that. I'll just plug it in for you. And one thing, let's see here. We might eventually soon, we will be on ANB TV and Assyria TV. So just something for people to know, ANB TV and Assyria TV. So just so you know that as well. So our first question, let's get this activated. Okay. Our first question is this. Can you get the cold from just going out in the winter without a jacket? So can you get the cold from being cold? That's the question we have today. That's question number 1. So if you want to put your answers directly into the polls, or you want to put your questions here and I can plug it in for you, we can do that as well. So what do you think? Can you get the cold from just being out in the cold? Or do you have to be sick from a virus? Anybody? Any answers? You can put your answers in the comments if you like. So we have a B. That's 1B. So if you want to guess, maybe. Okay, so it looks like everybody's shy today. And so the answer obviously is B. So you can't get the cold just from going outside, right? So you have to have either a bacteria or a virus to get you sick. Just simply going outside. Oh, we have an A. Let's see. So you have to have a virus or something, right? You can't just go outside and get a cold. So when people say, oh, I'm gonna go get something really quickly, and you have to put a jacket on or you'll get the cold, or they blame it on the cold, it doesn't work that way. Okay, so you have to actually have a virus, or by shaking hands with somebody, or somebody coughing on you. And that's why we tell people to wash hands and don't cough on people. Cultural background, yes. So yes, obviously my mom will tell me don't go outside. I think it's more for people not to go outside and not to go out in the cold, and so that's why maybe this happens. So everything obviously has a reason behind it. So a Milad Yohanan, yes. No, it's still, sorry, it's still B. So scientifically, medically, it's B, but culturally we can go with A. That's fine. Just keep the kids safe. Question number 2. Let me get the question number 2 ready. Question number 2 is related to the ginkgobiloba. So a lot of people like to take natural they call them natural medications that you can buy over the counter for different things. So this drug or natural herb is used. People think it's used for memory loss and dementia. So does it really work, or does it not work, or we don't know? So what do you think? Do you think because it's a natural option that it's good for memory loss and dementia, or no, it doesn't work, it's just good marketing strategies for people to use it, or who knows, maybe it does, maybe it doesn't? What are your thoughts on this one? This is a hard one, huh? Maybe no, it can't be hard. It's in there. It's in the question. The answer is in the question. A. Oh no. Okay, I got an A and I got a B. So we got a 50% chance. We'll give it a couple more minutes and then we'll go. A and B. Who is this? Because I said A and B. Okay. We have an A and B, then we have question mark. So now it's 33% for each. And then a D. Really? No. There's no D in there. Okay, so we have an A, a B, and a C, and an I don't know possibility. B, we have 2 Bs. Okay, so honestly, the answer is B. No, it doesn't. So there's been a study. We have studies that they did some testing, and no, just because it's natural doesn't mean it's going to help your memory. It could have. I would be careful from natural options. If you're going to want natural options, you can go eat apples and oranges or bananas. But if you're thinking just because it says natural on it that it's pure, it's not totally true. Remember, everything made in a factory is not always pure. The only pure thing is what God gave us in the ground or on trees. Okay, so the answer is B. No, it does not help. Thank you, everybody, for participating in Mythbusters. If you do have any questions for Mythbusters or something you're curious about, you can always send us a message on Renio or our email or YouTube, and just ask us that question, and we can look into it for the next time if there's a question that you want us to look into. Now we have our first guest. Obviously, remember one of our guests was called away, but her second half is here, and he loves to talk about his specialty. He's very nice. His name is Dr. Gabriel Dunya. He's from Lebanon. He studied in the American University in Beirut. He's super nice. I know this guy for maybe 30, 40, 50 years, right? And do apples and oranges help preventing? Maybe. Ask your doctor. There's a question that says, do apples, oranges, and bananas help with preventing memory loss or dementia? Yeah. Well, eating healthy would help and keeping your mind busy. So let's bring on Dr. Dunya. Let's see here. Doctor, welcome. How are you doing? Shaino, how are you? How are you doing?
Good. Everything's well.
Good. How is the wife, the kids, the parents?
They're well.
Very good. So, doctor, can you tell us a little bit about yourself and where you work in Lebanon, and tell the viewers a little bit about yourself?
Sure. So I'm a doctor. I've studied in the American University of Beirut. It's been almost 13 years. Actually, I'm going to graduate in 4 weeks.
Congratulations.
Thank you. I'm finishing my degree in ear, nose, throat, and I'm going to pursue pediatric ear, nose, throat surgery in the United States. So hopefully, if everything works out, I should be there in July 1.
Perfect.
I'm a shamosha in the church. I've been participating in church for a long time, and that's it. I'm married to Freistil. I'm sorry she's not here. Our life as doctors is a bit busy. Sometimes we're called to emergencies and we have to deal with them.
Mm-hmm.
I have one son, one child, Tony Rabo, and he's 1 year and 1 month old, and he's amazing. That's it.
Beautiful. So, Doc, tell us, we wanted to talk today about some ear, nose, throat. Obviously, a lot of people are concerned about ear, nose, throat issues with the coronavirus, or just every day. It's always, I have an earache, my nose, my throat. Can you tell us a little bit about maybe home remedies and these issues? So let's say, what can I do at home if I have an ear infection? What can I do at home before I end up going to the doctor's office? Or and what does this actually do? It's if I eat honey, does it help? Or does it do anything? Or is it just because my mom said so? It's like that.
Okay, so first of all, we need to divide it. And our specialty is called ear, nose, throat, and we have to divide it according to what it's called: ear by itself, nose by itself, and throat by itself. Even though they're a bit interrelated, however, it's very important that we need to understand each by its own, each entity by its own. So we can first discuss a couple of things with respect to ear. The ear is very important for us to hear, as we all know, and there's several compartments to it. The external compartment, the middle, and the inner compartment. And each one has a very important role. What we need to do whenever we have some problems, for example, a person has some earaches and his ear starts feeling the pain. We have to look at everything all together. So, for example, if the ear pain, if there's some fever with it, so if the person has a fever with it, then we should go directly to the doctor. If there's ear pain and hearing loss, we should go directly to the doctor. If there is ear pain and a problem with the balance, also we need to see the doctor directly. So we have to look at these cues, and we have to look at what are the red flags whenever we have these problems. So ear pain by itself, without these symptoms, can be due to many things. It could be due to lesions or like small abrasions or any like kind of problems from the external part of it. It could be a neck problem. It could be from the jaw. A lot of people have ear pain from the jaw.
Yeah.
So whenever they clench at night or they have bruxisms or things like this can we call it a referred pain. So the problem would be actually here, but they will feel the pain inside their ear because they're very close together and there's actually a nerve connected. The same goes with the tonsils or things in the oral cavity or inside the mouth. If there is a problem with them, sometimes we can have ear pain. So the teeth can also cause ear pain. So we have to look at what are the things around it, what are the multiple symptoms we're having, and try to see if there's any red flags, anything that makes us feel afraid. We need directly to go to the doctor. However, there's some myth since we started talking about Mythbusters in the beginning. So I know a lot of people that have ear pain. They would put a garlic inside their ear to make garlic. Yeah, I've heard
that one. Garlic, okay.
Yeah, some people put a garlic inside the ear to get rid of everything that's nasty inside the ear. Yeah. This is definitely not good. It can cause a perforation in the tympanic membrane, which divides the external from the middle ear. It can cause hearing loss. It can cause even more infection, and we've seen weird stuff inside the ear. So please don't put garlic inside your ear.
So, what do you think about the people that burn candles in their ear? If we're on
so there's actually whenever we look at many studies, it is actually preferred not to be done, and there's guidelines show that we should not perform this due to many reasons. We can burn the external part of the ear. We can burn the external part, including the auricle or this part of the ear, which is called the auricle, or even inside, and this can cause further injury. People do it for the wax, but there's many other ways to take the wax off. I prefer personally, if a person just is feeling a bit of blocking in the ear, most probably wax, something not really severe, then a bit of olive oil inside the ear once or twice a week can help. It will help dissolve these wax or cerumen. And if it is more severe and it does not go away, then definitely a doctor can take care of that.
Yeah.
Many doctors do take care of that, family physicians, pediatricians, and even ENTs. So you can go to any doctor who is experienced in doing that. So there's no problem with that. Yeah.
I do a lot of irrigations. Mostly we do irrigations.
Yeah, I've never done any irrigations. We're very well equipped in most of our clinics. Yeah. So we can suction out or grab them with small things. We have the microscope, so we have the luxury type of dealing with these patients. But definitely irrigation is part of the guidelines, and it can be done. It is the normal way of taking care of ear cleaning, but should not be done by somebody who's not a professional and who does not know how to deal with it. Yeah.
Perfect. Can you tell us a little bit about throat issues and what people can use at home with, let's say, throat infections?
Yeah. So it's funny you put also a part of the Mythbusters that if you go outside with a cold jacket, if you get a cold, or you can get a flu or any kind of infection, viral infection. So it is, from what I know, is that whenever you have a cold weather, your immunity can be affected. Not really cold in general, but really in winter. So the immunity is a bit affected, and this is why we have higher possibility of having infection in winter. At the same time, the viruses can survive for a longer period of time. So whenever we talk about the throat, we need to look at many things. We need to look about also the red flags. So anytime we're dealing with anything medical, always think of the red flags. Fever, not able to swallow, so on and so forth. These are very important, if present, to directly seek medical attention, either the doctor, the emergency physician, any nurse practitioner, or anybody that can help you. So do not do not just stand by and feel the pain and fever and not able to be able to breathe well or eat well. These are red flags. So as with the ear, the throat also has its red flags. If you have a regular cold, which is like a bit of pain or feeling like something's heavy inside, and minimally affecting your swallowing or your speech, then there are many home remedies we can take care of, we can use. These are the same for most viral diseases. You can take some water, drinking very well, hydration. So water, some any kind of fluids is important for this. Otherwise, you can add. You were saying honey. Honey has been studied a lot, and actually, it has a lot of good effect on the throat. A lot of good remedies. It soothes. It helps. Many of the pills or like small the pills that people put in their mouth to feel the remedy. Have a lot of honey in it. So honey is one very good option. Another option is I've learned this. I've read it in many studies, but also I learned it at home. You can put some lemon with honey instead of sugar, and it should be a bit warm. And these help just to soothe. They don't really treat the disease, but it just helps to relax and soothe the pain or the discomfort one is having. So it will not be a treatment, but it will help with the symptoms. If things are not calm by then we can take just a Panadol or like acetaminophen, which is in Lebanon known as Panadol, and in the States is Tylenol also. So these are things we can take just for the pain and the discomfort mainly. Otherwise, we have our red flags, and if anything is wrong, we need to talk to the doctor directly. So I have a question, which is, what's the symptoms of strep throat versus a cold? How can someone tell the difference? So this is really a big question, because there's even some discussion between family medicine and ENT and pediatricians and ENT. But there's clear guidelines that we look into. First of all, if we have high symptoms that look like strep throat, they need to be examined, and then a swab culture or a swab should be taken from the throat to make sure that this is strep positive or not. So some physicians have the rapid strep test, and this helps a lot. However, a basic cold which does not have a lot of symptoms can be differentiated from a severe strep infection. Usually we have higher grade of fever in strep infections. We have small abscesses or whitish discolorations on the tonsils or on the back of the oral cavity. And this can be both present in viral and in strep. However, they're more found in strep infections. Also, some differences. If there's a regular cold or a viral illness on the throat, we might have some lymph nodes here around, and these are usually viral in origin. They can be present in strep, but they are usually viral. And definitely, if we have a cough, then it is more likely to be viral. So these are main things we look at: the severity of the fever, if there's more fever, the pus or there's micro abscesses on the back of the oral cavity or the tonsils, if we have any lymph nodes in the neck, and if we have any cough. So this is the most what we look at. To be 100% sure, we need to do a culture, and we need to take a rapid strep test. These will help us a lot. And most of these are related to most of these can be treated at home. We can wait on them. However, if they stay for more than 24 hours or 48 hours, then definitely we need to seek medical help.
I had a question for you. What happens? I get this a lot in my clinic. People get sore throat multiple times in a year, or they get the strep throat many times in a year. When would you recommend somebody to say, this is time when I need to give up and go and maybe get my tonsils out? So how many times a year is normal to have strep throat? How many times a year is it not normal, and so forth?
So this is a very important question, and we need to first make sure that we follow the guidelines. And however, we need to know some of the risks of this surgery. This is a surgery that has a lot of risk, especially whenever the patient is older. So any patient who is adult, actually 16 years and older, they have higher risk of having side effects from the surgery. The worst of them would be bleeding. This is the worst. The second worst is severe pain. So it's a very painful procedure. It is less painful and less risky in younger children since the vessels are not well formed yet and the nerves are not well formed yet, and these will cause, as I said, less bleeding and less pain. So when do we do that? We do that whenever, as you said, we have documented strep infection. So we cannot say that, oh, I had fever and I have sore throat, do we have strep infection? No, this is not a strep infection. It should be documented at least a couple times per year. So if you have classical symptoms, a positive strep infection, in 1 year, we should, if a patient has 6 times, then we should recommend or at least suggest for them that it's maybe better for them to remove the tonsils. If it is so in 3 years, if it is three consecutive times, so 3 times this year, 3 times the next year, and 3 times the year after, we should also suggest. If we have in 2 years, it should be 5 times the first year and 5 times the second year. Okay, so these are like, if you want, the guidelines. However, if the patient says, I don't want to take the risk, then we can say, okay, you don't have to take the risk. It doesn't really have a lot of side effects unless we have like a severe infection, which might affect really the breathing or the swallowing. So this is something that the patient should discuss with his physician. So it's very important to have a good discussion and documentation of the infections, as we said.
Perfect. Let's see, there's some more comments. Okay. So there's a private question, something about ice cream. So let's say I have tonsil problems or a sore throat. Can I have ice cream? Is that a good excuse for kids to have ice cream, or husband?
So this is actually a pretty interesting question because we have a lot of debate with that. So personally, I think ice cream is a good remedy. First of all, because the children like it, or the adult like it even. So it has a good taste to it. And whenever the patient has either a surgery that he removed the tonsils, or if they have severe infection and they're not able to swallow well, then they need something that they like, first of all. The second is it's very smooth and it will not hurt the area. So anything that's smooth will actually comfort, and the coldness in it will actually decrease the inflammation, decrease the blood vessels going there, and would give this calm effect. So definitely, I think a bit of ice cream, not like taking 4 or 5 ice creams. This has many other problems, and actually might hurt the tonsils because severe decrease and the temperature will have a negative effect on the throat. So definitely, ice cream would help definitely.
Good, ice cream, and I would say chocolate ice cream. This is better. So chocolate ice cream would be our professional opinion. Very good, doctor. Thank you, doctor, very much. Thank you for answering the questions. And everybody, if you still have any questions for Dr. Dunya, he's going to be on while we talk to our other guests. So you can still put your questions, and we will get back to you towards the end of the show. And Dr. Dunya, any final words before we go to the gifts again?
Thank you so much for this interview and this discussion together. And thank you for putting this up for all our people all around the world. And we feel that we're very connected with this, from the Middle East to the US to Sweden to Germany to all over the world. And God bless you.
Thank you. Thank you very much, Dr. Dunya. Thank you. We'll see you at the end of the episode. Thank you.
Yeah.
Okay, everybody. So remember the gifts. So the gifts are from Sweden and Germany. So far, the people that tagged are from Chicago and Lebanon. Well, God bless you guys, but we need some Swedes and Germans. So the first gift is helping people to do resumes and job interviews. Obviously, during these days, it might be harder to find a job. So these nice people will help you go through 45 minutes of job coaching, interview coaching. Obviously, this is in Sweden. I have no idea how to read this, but I did translate it. So it's all coaching, interviews, things like this. Our other gift is from these nice people. She's going to make you a diaper cake, right? So a diaper cake. Let me find a picture. Diaper cake is right over here. So it's a cake from diapers, and they're clean diapers. Okay, so don't worry. And you can see all these nice things that this nice person does, and she's from Sweden, and so whoever wins from Sweden will be option to pick her. And then from Germany, we have the lady that makes the wedding cards. You see here all of her pictures from her Instagram. She does very nice work. She has some Christmas stuff here as well, right? So if you know anybody from Sweden or Germany, I would tag them to see if they would tag people so that they can win something. Okay. Let's go back here. And then our next guest, we have another guest, right? So let's bring up his information. Now we have Alex. So Alex, I wanted to bring Alex on because of what he's doing there. So obviously everybody's trying to do their best to help. And with Alex, he's a computer science software person, right? So one of those IT smart people that you ask them how to turn your computer on. And so, but other than that, he's doing more than just that in Sweden now. He's helping, he's trying to be active, he's participating in his community a little bit more. So I wanted to bring him on board and try to hear from him and talk to him a little bit. So let's bring Alexander on. Alexander, how are you doing, sir?
Yeah.
Welcome on the show.
Hi, Robbie. Hi. Hello, everyone. All is good here. How are you?
Good. Thank God. Everything's good. Everybody stays home here.
Thanks.
How is Sweden? I hear you guys just go everywhere.
Yeah, it seems like it, but I think there's been there's probably misconceptions of what's happening in Sweden. Everybody's free to do whatever they want. I think it's somehow it is like that, but somehow it's not. We are. The government is saying, please keep distance. They're not forcing everybody to stay at home. It's not like in China where they welding shut your doors or anything like that. But they'd like us to not kiss everyone we find in public.
Yes.
Yeah. So, hi, Sandra.
Oh, Sandra from Sweden. Maybe Sandra can win.
Yeah. So the idea is that most of the stuff are open, but still people are afraid, and most of the people are taking this seriously, and we're trying to not be too social. Well, we're trying to show our love to our neighbors, but from a distance.
Perfect. So Alexander, tell us or tell the audience about what the work that you're doing right now with helping people.
Yeah, so the idea the idea doesn't come from me. I saw other people do it all over the world, but I noticed that most of my neighbors are pretty old people, and I see them wearing masks, and they try to walk away from everybody they see, and they have the right to do it. Basically, take care of themselves. So I was thinking that. Let me try to help out a bit. I am still pretty young, pretty healthy. I eat fresh food.
Good.
Lots of oranges.
Yes, good.
Yeah.
And ice cream.
Yeah, and ice cream, of course. So I was thinking, I'll try to do something, at least to my community around, the neighbors around me, my building and the buildings on the opposite sides of where I live. So I was thinking, let's try to help out as much as I can. And the idea was quite simple, actually. I didn't want to do anything so super exciting, but I was thinking I'll do something very important, and everybody needs food.
Yeah.
So I offered actually to hand out or to buy the food for the people from all these shopping centers or
Yeah.
shopping markets around us. So it was the ICA, Willys, and ICA Maxi. The Swedish people know which ones these are. They're huge. And so that was my offering for my community.
So how did you find these people? Like, did you talk to them? Did you knock on their doors? How did that happen?
Yeah, given the fact that I didn't think that it was a good thing to knock on people's doors or maybe kick them down or whatever.
Yeah.
I wrote a document. I wrote a small info page, info document, and I posted it in the entrances for the buildings and also in the elevators. The elevators are typically where people just stand and hang around and try to read stuff. So I was thinking this would be the absolute best situation, the best place to
find the people.
To find the people, yeah. I got many thank yous for offering this. People do respect and are very happy that this is an option they can use.
So how many people do you think you're helping so far? Are we talking about 10, 20?
Actually, not that many. I think either it is because people are in generally very still not afraid of going out and doing their business, but also because and I'd like to think that there's actually their kids and grandkids are more involved in making sure that it's that the situation actually works out.
Okay. So
I think it's
Do you usually, let's say, go and let's say if I need something, do you make a list, or do they make a list, give you the money and you go, or is there somebody from these restaurants that is helping you?
No. It's totally built on trust. They tell me what they want. That's the idea. They tell me what they want. I go do my best to get all of the stuff, and the receipt is my proof of what everything costs, and this is what they pay. Either via Swish. We have an application in Sweden, so you can swish money to an account via their telephone number. That's very effective and quick. Or if they want to pay cash, so that's how it works.
Have you tried maybe talking to some restaurants, or do you find any resistance from people there, like offering maybe discounts or something?
I have talked to I've actually talked to some people, one restaurant owner, but I haven't really we haven't come further in the discussions or anything like that. So I don't know if it I don't think their business is that good right now, restaurants and stuff like that. Like I told you, even though the government doesn't really they don't force anyone to close, but the situation doesn't really allow for big business in restaurants. We are conditioned, let's say, to not sit too close to each other and not to stand too close to each other. There are rules that have come into place that you're not allowed to actually stand at the counter when you're ordering food. You have to sit on the table, and the waiter has to come up to you. So there are rules and regulations that have been set in place. I don't know how well they are enforced, but I think the situation is like this, that people don't go out, and maybe it's not as
Good. Well, it's good that helping people. I just, maybe if anybody knows anybody that has a restaurant in Sweden that wants to participate,
Rob,
good idea. Yes. Did you want to say
Doctor,
something?
I got some issues with the internet. Sorry, I couldn't hear you. Sorry.
Yes, sorry. Everybody seems like Dr. Dunya is having issues. It's okay.
Yeah.
Right? It's okay. It's the virus.
Yeah.
So I was saying that it could be nice if anybody that's watching that knows any businesses in Sweden, maybe we can help benefit the business, right? I'm not thinking free food. I'm thinking maybe instead of just buying from random big companies, maybe we can help support the local stores and local restaurants instead in Sweden. So like we're trying to do that now in Chicago. We're trying to push people that are going to buy gifts for birthdays or Mother's Day and Father's Day is coming up to try to buy from local businesses instead of buying from the bigger companies. You know, the big companies is good too. Obviously, there's nothing bad with them, but to help the local people. So if anybody knows anybody in Sweden that has a restaurant that wants to increase their business, and maybe they can contact Alex and maybe they can order from food from there and so forth if anybody's interested.
Yeah, I think one thing could be a good suggestion is that even if you're afraid to sit in a restaurant to eat, you can always order takeout. Most of the restaurants do offer this anyway.
Yeah.
If you want to support the restaurants, for example, that could be a good way to do it.
Yeah. Yes, I agree. Perfect. So Alex, thank you very much for your participation today. It was very nice. It's good to hear that people are helping each other. And so let's go back. Let's bring back everybody now.
Yeah.
I think Dr. Dunya is back as well. Or Dr. Dunya is having internet issues.
Yeah, he said so.
Having internet issues. So,
maybe, it's COVID taking over the Lebanese network.
Is the virus affecting your connection?
Yep.
Let me just see. I have. So let's see. So gifts so far, we have again the 2 people from Sweden and 1 person from Germany, and it seems like we have only 1 person from Sweden that tagged a lot of people. Alex, do you know this person?
Sandra is a nice person. I know.
Nice person too. Wait, we lost him. He said nice person.
Sweden now.
He said nice person. I did not disconnect Alex. He just disappeared. So let's give him a couple seconds. But if everybody, again, thank you for participating. The shows eventually, maybe the next week or so, will be on ANB TV out of San Jose, and they'll be also on Assyria TV out of Germany. I think, let's see, Alex, are you back?
Yeah, I got logged out. I don't know why.
From the IT guy.
Yeah. Nobody's spared. Nobody's spared.
Oh. So I was saying, or you were saying she's nice. So you know her? So
Sandra is. I've known her for like ages.
Ages.
Yeah.
Perfect. Like a long time. So Sandra's our only winner today that will be eligible because she's from Sweden. So Sandra, I'll just put you in touch with Alex, and he will take care. You can pick one of the 2 gifts from, or maybe so the German Euro certificate. I think it's mostly just Germany, but if you really want that one, maybe we can talk to her. But otherwise, you can pick from the 2 options from the other Swedish people. Now, everybody from Chicago that I didn't contact yet, sorry, my clinic is kind of on the busy side the past 2 days. I will get back to everybody today, though. If anybody has any final questions or anything for Dr. Dunya or Alex, or any questions, or if you have anything you want to be on the Mythbusters or topics, we could always bring back our guests and have more interviews. If there's no more questions, anything, guys, any final words, anything? All good?
Thank you so much for this opportunity, and thank you for everything, Robbie.
Yeah, this is why I wake up Saturday mornings now to talk to Dr. Okay, well, everybody take care. Have a great weekend, and hopefully it'll be nice outside. Remember, stay 6 feet away, wear a mask, don't cough on anybody.
Yeah.
Okay? We'll see you Wednesday. Bye, everybody.
Take care. Bye.
Bye.
Bye.